Hi, I'm Sharona Justman. I'm the co-founder of the Israel Conference, and we're bringing you another episode of our conversations, fascinating discussions with Israeli entrepreneurs and thought leaders and industry creators. We like to talk, especially during this pressure-filled time in Israel, about what's happening in the business scene in Israel and talking to Israeli entrepreneurs who are engaged in cool endeavors, as well as the work that you're doing in nonprofit activities or military activities in reserve duty to support the state of Israel. This way we have a chance to understand the many different profiles of great, smart, highly active individuals who are making a difference in business and in the social world. So you can find our interviews at theisraelconference.org, along with a lot of information about Israel's simple facts, actions you can take, and people that you'd like to meet, especially today. Today, we have the pleasure of meeting with Ramon. Roy is an entrepreneur. He's experienced internationally. He's a founding partner of Zero Gravity Capital, and he's a former investor at Intel Capital. He was the founder and managing director of the Israel Ingenuity Partner Program, where he accelerated Israeli startups. He's also a graduate of the Israel Naval Academy, cum laude, where he was the head of communication and the head of cybersecurity for the Israeli Navy. Roy's very talented. He holds many, many patents. And he, as an entrepreneur at heart, he sold his first startup, which he'll tell us about, at the age of 17, just a few years ago. And today, Roy is the chairman of a very interesting company that we're going to learn a lot about called Powerful Medical, which is combining artificial intelligence and cardiovascular disease. But before we go into Powerful Medical, hi, Roy. Welcome to today's episode of Conversations.
Hi, Sharona. Pleasure to talk to you again. It's always nice, and thank you so much for the support in Israel. It's really needed at this time.
Absolutely.
And I think that all of us appreciate whoever is sitting in the US or anywhere else and helping us provide the truth and real picture of what's going on in Israel.
Yes. Well, there's so many aspects to Israel today because as we know, there is an element of business as usual. People are continuing with their endeavors, living their lives, while under an umbrella of tremendous tension and apprehension because of the attack that was perpetrated against Israel on October 7th by Hamas. But in that backdrop, before we talk about what you've been doing to support the state, I'd like to learn a little bit more about Powerful Medical and how you got involved in such a complex arena of medical advice, and artificial intelligence.
Yeah, well, like any, I think, a Jewish boy, I wanted to be a doctor, but then I became an engineer. You know, medical industry always fascinated me. And so first of all, I came to this company through maybe a grief or a sad story where my dad went to the hospital and he fainted. And he got tested, did the EKG, and was discharged from the hospital. And after stating that everything is okay, and unfortunately, 20 hours later, my mom found him in his bed, which, you know, it's sad. And then I became familiar with so many other cases like that. And one of the things that we're doing in Powerful Medical is trying to prevent these cases exactly, where people come to the hospital, and about a third of the people that even if they diagnose them with some heart condition, before they go to the cath lab, they're sometimes misdiagnosed. And this is where AI can come across the biases that we have as human doctors and sometimes accelerate to the treatment of more urgent cases onto the right treatment flow. And today, the clinical management as a whole is something that is not working well, especially in cardiology. So in cardiology, the process of a patient being treated is encounters sometimes a first responder or paramedic that is testing it. Then somebody's being escorted into an emergency center. Not necessarily that emergency center even have the capabilities of handling a heart condition. And therefore, one of the things that we do is by using a simple application, you just scan or take a picture of the EKG, and then you get a cardiologist in your hand that can tell you exactly what to do, where to take it, what is the right treatment flow. And right now we're in the process of filing for the FDA. We're already certified to work in Europe. I think that our greatest goal is to save as many people as we can and to prevent these excessive deaths. And along the way, there is huge economical benefit on doing so because, first of all, it saves hospitals money, it saves healthcare, insurances, and so forth. So there is a huge opportunity here to solve a unique problem that exists for many, many years. And we have the right tools today to solve that through machine learning and artificial intelligence that can detect and understand these preconditions and can recommend the treatment for the doctor or assist the doctor or nurse.
Is this a solution that the doctors use, or is it something that a patient can query in advance of choosing a doctor?
Like any new or disruptive technology, it starts with the point of care, which is today, which is the paramedic and or nurse or general practitioner or some medical staff. For example, for pre-operation, a doctor, the orthopedic need to sign for the EKG. Right. And their last time that they encountered EKG was when they were in med school. So now they have another second opinion without the need to ask for a second opinion from anyone, which is good. And it creates a very unique, first of all, unique accuracy, but also if we look at that from in the future, it can drive into the consumer space. But again, we are a medical company and we're aiming our customers are the medical personnel and staff.
So let me take a step to the side. How did you have this tragedy, which my heart goes out to you on, with your father? So it must have been sitting in the back of your head for a long time. How do you solve such a problem? How could such an event occur in a hospital where a patient is not getting the optimum care? So did you bump into some very smart doctors who were also engineers and pose this idea, or did you come up with it from scratch?
So no, I didn't come up with the idea. I joined a team that was already doing it, and I invested in that team. And I gave some insights and I gave some recommendations, but mostly that they came up with the idea, and a lot of very smart doctors that came out with the way that the solution.
How did you find these folks?
Sometimes you know, universe sends us the right signal. So right. They actually came to me as an investor, and that's how I came across the team. And I think that this is the star aligned sometimes, right? And this is exactly the case where star aligned. And we've been working together even before my dad passed away. But then when my dad passed away, I joined and joined it full time. And I think that this is a very, very unique team. We have Martin Herman. He's also had the same path as me as a young entrepreneur that started really early on. And then on the other side, we have Robert Herman, his brother, which is one of the youngest cardiologists in Europe, and also he's part of the European Cardiology Council, which is explaining or instructing doctors of how to take care of patients. And then we have more senior doctors with Professor Hatala and Dr. Lior Pearl. So Dr. Lior Pearl is the head of innovation for Bellington Hospital. He's an interventional cardiologist, and he's the chairman of our scientific board. And we are very fortunate to say that every doctor that had started working with us have somehow joined the company, either part-time, full-time. And it's a good problem to have. Also, some of the company investors are doctors today. And right now, our main focus is, it was a bit derailed due to the war and this horrible attack over Israel. But we are aimed to move the headquarters of the company to the U.S. and start addressing the U.S. market. We already submitted the FDA. Hopefully, it will be received in Q1 when we can start engaging. We already have about 16 hospitals in the US that are doing some pilots with us and participating in some of our new features and a disease that we want to identify.
So is it a device that the hospital purchases, subscribes to? Yeah. Let's discuss a little bit your revenue method, your revenue model.
The hospital, they use our API and they use our software to analyze the EKG or ECG, depends on where you are. Then on the other side, we have paramedics and nurses, general practitioners that just use our use our phone application, and they just take a photo of the EKG machine or the printout or whatever
Wow.
form it comes out. We digitize it and then give them the diagnosis and treatment recommendation.
So what liability are you taking on with that, or is it subscripted that this is an additional opinion to be
So
interpreted at the cardiologist's decision?
so we are certified to diagnose, to not only to recommend.
Okay.
And this is our certification in Europe. I think that the FDA will grant us the same conditions. On the business side, today, most of our revenue comes from subscriptions. So just doctors go to the app and subscribe onto the application. And I mean, also, I didn't say it, but we launched it in May, so late April, May. So the fact that we already have customers, paying customers, I think it's pretty unique in the medical industry. What we do is we back the one thing that we understand is that in the medical domain, you need to have a lot of research done, or you don't get trust. And so, as a new system or a new solution, one of the things that we're doing is we have a lot of independent studies that are done by centers all over the world. And what we do is we just give them the software, and then they do whatever they do. They test it, and they publish the results. And it's good for us because it's creating credibility. And I think that a lot of these companies in the medical domain did not create or did not form the right credibility.
Yes, to be trusted, especially at this level. So hospitals are the customers. Doctors who practice in hospitals are the customers. The patients are not the customer.
No, but also first responders. So it can be Hatsula, right, in the U.S. or other emergency services we are working with.
Can ambulance companies be a customer of this?
Yeah.
Okay.
I mean, we do have some of them as customers already.
Wow. So you have a huge market that you're addressing. Are there other companies that have developed something similar by chance?
We have competitors. Yeah, we do have competitors.
Because I would imagine as AI is
we do. Yeah, it's like like anything. We do have competitors. What we are doing is we're focusing on being the best and most accurate,
of course,
and doing the most research to help doctors make the decision to use our software based and not others.
So what is a compelling reason that they would use Powerful Medical instead of competitor 1, 2, or 3?
So one, we have patents that the digitization part with the phone is patented by us. So it will be a huge problem for them to try to copy the workflow. And that makes the integration to any system much easier and simpler. In a normal hospital, you have at least 5 different types of EKG machines. And the variety of EKG machines, that's one of the reasons that you cannot really have innovation, because you need to tap into the hospital servers, and you need to connect to that, and then you have IT issues and security. And this is very simple because all we do is we push the data in, and we can gather the data through a simple cell phone. Second thing is training. People know how to use a cell phone, and we don't need a specific or sophisticated machine with a lot of buttons. It's very simple. We made a lot of focus in the UI. And last is we did a lot of research to help the doctors feel confident using our tool as a diagnostic tool. And last we are constantly adding new diagnoses that were not been able to be diagnosed before using EKG. And then we do a prediction as well, which is something that I mean the market here is I think we're just tapping to the beginning of the market, but the traction that we see is the hunger. The hunger comes from 2 reasons. One, about I think quarter or third of the cardiologists are above 60.
Right.
Meaning that there is going to be a huge shortage in cardiologists. There already is a shortage in cardiologists, but it's just going to get worse, and they will need to focus at handling real problems and not taking care of interpreting an EKG. Right. And this is where these solutions will come into place, and we hope that our solution would be best in practice and will be used as a standard.
As a predictive tool, do you see a future layer of the powerful medical integrating into rings that people wear to monitor their health, or other devices that people with a propensity for cardiovascular disease might be using to track and monitor, and then use your device?
Definitely, this is a, at the end of the day, this is a target, because we all have like our smart watches with
Right.
a EKG capability. We need to differentiate between what this is, which is a novelty device. It's not a medical device per se. Can it get there? Yes, but not now.
Okay.
And second, I also think that the devices itself, they do not want to be a medical device as well, and therefore there is a
fence between the two.
Yes, we have the ability today to work with the leads that are provided by the Apple Watch or Samsung, but it's not medical grade.
Okay.
And that's one of the reasons that we decide to focus at our core capability, which is medical device and medical grade solution. Later on, it's easy to go from medical grade to the other side. It's very hard to move from the amateur or novelty to the medical grade.
So there's another side to this of electronic medical records or healthcare information systems. To what extent are you integrating so that I, let's say as a patient, can carry my own medical information, the diagnosis that Powerful Medical provided, and take it with me, so that it's
so this is I think more of a strategic overview, because the overall strategy is to allow computers or AI to analyze your medical records and constantly create recommendations that are tailored to you. Now, on the short term, these recommendations need to be a little bit more narrow, so they can handle diabetes, heart conditions, maybe let's say some things that are more narrow and not wide in reflection to the patient as a whole.
Mm-hmm.
And as more as these systems progress, we would see more and more or wider approach. So it's called multimodality, where you have multiple of inputs that are being fed into the algorithms in order to make more accurate decisions and better predictions. And definitely this is something that we're working on, but this is where there is a balance between what the regulators allow us to do and to certify to the capabilities of the system today.
Okay.
And that balance is something that we need to try and control and balance it, because at the end of the day, I'm not General Electric, I'm not Philips, so our budget is limited, and we need to focus at things that we can do and not do everything at once. And the decision was to focus at clinical management flow of cardiology. And what we're doing is we're tackling the entry point to that. We do have capabilities, for example, today to read echo or CT and MRI, and to create 3D modeling of the heart, but we are not focusing that as products. We are now focusing at interpreting the EKG, penetrating as many hospitals as we can.
So as a young company, this is a great follow-on to that. What do you need in the short term in order to continue to expand in terms of people, customers, money?
Customers, right?
Right.
So once you have customers, money will follow. We are going to start with fundraising soon in order to accommodate for faster market penetration in the US. And we are also going to have, right now we're in a weird situation where we have a lot of hospitals in waiting list to do trials, and this is something that we need to understand how we serve just our waiting list. And so my only wish is that I can convert the waiting list I have now to paying customers, and the company is extremely profitable at that moment. But it takes time in the medical domain. And we know that, and that's one of the reasons we want to do fundraising, in order to have enough cushion in order to hold that time from the point that we do.
You also need some really solid account managers, sales support, and as part
I mean, I didn't start hiring, but in, I would say, 4-6 months, definitely we'll start hiring a lot of them.
All right. Well, you're in a good position. If you're in demand, there's a queue waiting to use the system and convert those into long-term subscribers.
Yeah.
So powerfulmedical.com is where our audience can go and learn a little bit more about it. But Roy, you've done a lot, and in with Intel, with the work that you've done with the Israeli Navy, and during this critical time since October 7th, you've been called up for reserve duty. Um, there's many things you can't tell us about, but what can you tell us about that's occurred since October 7th, where you've been able to make a difference in helping the state of Israel weather through this terrible time since Hamas attacked Israel?
It's it's always a privilege for me to be called to serve Israel, the only Jewish country in the world. And unfortunately, one of the things that we've seen right after the attack, when Israel was considered to be weak, all over the world, people start attacking Jews. And Israel is not just needs to stand as Israel, but also as shields to Jewish communities all over the globe. And this is one of the things that I encountered when I was there. And I'm happy that I can still go and contribute to try and help save life on both sides. And this is one of the things that I think truly about the way Israel is conducting this. Even though there was these atrocities and horrible things, some things that I've seen that I cannot even repeat. These horrible things, we are still treating the enemy with respect and treating the civilians in Gaza with the highest morality that is available in a war zone. At the end, we need to remember it's a war zone.
Right.
The second part, which is horrible, is the miscommunication around the world on things that are happening in Israel. And one is, I was so shocked about how the media coverage is referring to Israel and to the deeds that Israel is doing, with no mentioning of what's happening to the Jewish people in Israel, and that the fact that they're being attacked and murdered just because they're Jewish. I think that's one of the things that is the hardest. And then from reserve duty, I think that I would say that together with me there is CEOs, president, chairmen of companies, even publicly traded companies. Everybody is stepping in and trying to see not what they can do to help. And one of the things, by the way, you mentioned at the beginning that I'm also in a nonprofit organization called EFI, and it's helping people with communication issues or difficulties. I'm trying to find the right American way to say it. Asperger and the autistic spectrum, people that are on autistic spectrum. And what we're trying to do there is help them assimilate into society in the best way possible. So it's from helping them find jobs in the day-to-day, or helping them join the IDF and contribute to the IDF, or helping them with helping them finding dates.
I read about a program, Roy, that takes those who are on the spectrum, who are of military age, where some of them can participate in a special unit to use the unique skills that those on the spectrum have, who are able to participate. Is that something that EFI is part of with the IDF?
So we have a program, again, referring to the IDF, there is IDF spokesman and needs to talk about the IDF. I can say that what EFI is trying to do is trying to help these young individuals make the most of their military service and to contribute the most. And I think that, not every person on the autistic spectrum has a unique talent or capability, but all of them deserve a fair chance in life. And this is what we're trying to do, is give them this fair chance and road to success. especially in the Israeli society, where military service or serving the country is extremely important in the culture.
Right.
And the other part that we have now during, let's say, I'm calling it wartime, the organization had to open a call center to help them and to mitigate the reality to them. Some people on the autistic spectrum the changes are very hard for them. Loud noises are very hard for them. And you know what? There is a lot in war. There is lots of changes and lots of sounds that are horrible from their perspective.
Mm-hmm.
And what we're trying to do in FE is to help them understand or become a support center for them, where they can call, they can talk to someone, they can talk to professionals. We have a lot of volunteers that are helping them in a call center and providing them with the right assistance and help, and also providing information in an accessible way for them, because not necessarily the way that they perceive the information or sirens is the same as a normal person perceive that.
So right now there's a heightened need to help those that are on the spectrum, because the tension that's in the air is materially affecting their ability to cope.
Especially them. At the end, it's hard for every person, but for them, it's much harder. Imagine, how long it takes them to understand the world, and then now there is sirens and people running and rushing and sounds of explosions. It's difficult, and some of them.
How much of that learning can be extended to the population as a whole? There's so much lack of understanding and inability to cope by those who otherwise have the native abilities to cope. It's sidebar benefits of what FE is doing to society in general.
In general, I think that helping the weaker side in society always help the general population.
Yes.
And I think that especially people that are on the autistic spectrum or Asperger, they have uniqueness of perception, mm-hmm. And they're also on a higher risk of developing anxiety or PTSD from even minor things.
Right.
And in order to prevent that, one of the things that you do is, if you provide the right mitigation and the right communication to them, it can tone down the effects of this harsh environment. And I'm very proud that Israel as a society, no person is left behind. And I see that, even that we are at war, you see them part of the army, and you see we have people that are 90 years old that are volunteering into reserve duty, and kids that cannot join the army are helping with call centers, or helping with logistics and helping to pack things and sending food, or hosting kids that are being evacuated from the war areas. I think that this is, the faith we lost the 7th of October in humanity, we gained again when we saw the strength of the people of Israel, and how everyone pulled in together in a matter of hours. You had war rooms and that are helping provide food to elderly and to help handicapped people, evacuate them from other areas. Organizations like FE created call centers to support the weaker communities. And beside the war itself, which is always a horrible thing, and we never want to do it, but sometimes you have to. And I think that at this point we have to.
Before the attack on Israel, there was a lot of discussion going on about the economy in Israel and investment into Israeli companies. And you, being both a venture capitalist as well as a chairman of technology companies, I'd like to get your perspective on what you see happening in months to come with respect to investment into Israeli companies, the growth of the economy, where the shekel, the Israeli currency, has got weak and then got strong again recently. Where do you see it as a businessman over the next 6 months to a year?
So short term, it's hard. The war takes a toll on economy. A war is an expensive thing, and uh, somebody needs to pick up the bill, and the government would need to pay a lot of money to support the citizens, reserve duty, and so forth. On the other side, after every war in Israel, there is a boom of technology, not only military grade, but the military grade technology creates a new ideas and new concepts that are booming. So you see today startups from surveillance to communication to screening fake news or helping edit media from frontline faster. Uh, these things will become technologies that will support the effort, and later on will become technology that will be providing civilian usages as well. And at the end of the day, human capital of Israel is still there. And I think that if before October 7th, some people thought maybe I would not stay, maybe I want to move and live somewhere else for a bit. I think that now most people understand that as a Jew, there is one place, and it's called Israel. And it's the only place that you can be safe, and it should be safe for Jews to be Jews. And I'm not saying that, I want Jews to be free everywhere, but this needs to be, I would say, the Jewish bomb shelter, okay, where every Jew can come and feel safe and protected. And you see one of the things that you see is, whatever we lose on the business side is coming from countries now that see the Arrow 3, for example, this anti-ballistic missile defense. So a lot of countries now order that because they see it in action and they want it as well. And I mean, at the end of the day, this will cover up for some of the losses that we have on the other tech industries. Now on the world effect and world media, I think that there is a lot of things that we will need to practice as the Jewish community to make sure that media coverage of Jewish news is done in the right way and is echoed, and that we are not left behind in terms of news.
That's true. And one of the things that we are doing, and with your help, it gets even stronger, is to communicate the businesses that are existing in Israel, job creation opportunities, and lifting the economy so that all boats rise. Anyone who's associated with Israeli companies, including neighbors to Israel, see their economies go up because they're involved in the active work of creation. And that's part of the joy of the work that I've done with the Israel Conference, is to meet extraordinary people like you, Roy, and watch while companies are developed from an idea to full execution and have the purchase orders come in from around the world.
Yeah. And unfortunately, companies need safety to operate, and this is one of the things that we need to tackle as well.
Yeah.
It needs to be a safe area, so it can be an international hub for tech, and it's important that we will get to that point where it becomes safe again to be around. And I wish that our neighbors would also teach their kids, as I teach my kids, peace is where we need to aspire to be, and not as they aspire to eradicate and kill all Jews, which is horrible. And this is one of the things that we need to echo, and I think that we need to make sure that every person understands that we just need to change the way that they're educating their kids, so we have a chance of peace, not now, but maybe in 20 or 40 years from now.
Well, we'll keep doing that together. But in the meanwhile, it sounds like you are actively saving lives with Powerful Medical, and you're providing purposefulness for those on the spectrum. And your work with the Israeli Navy, I'm sure, has been extraordinary and important. And it's an area that we often don't think about, is how do we protect ourselves from in the sea. And next time maybe we'll dive a little bit further into that. But thank you very much, Roy, for pulling back the curtain and helping us see all the things that you're doing. It's a joy to know you. Roy Ramon, thank you.
Thank you, Sharona.
Shalom and lehitraot.
Bye.
Bye.
Shalom.
To see more conversations with extraordinary Israeli entrepreneurs, visit theisraelconference.org.